Do you live in Europe or the United States? Are you in need of prescription antibiotics? If your answer to both questions is yes, then you know what we're talking about. Several Western countries are reporting a serious shortage of antibiotics and paracetamol. With the winter here, infections, especially flu cases, are spiking worldwide, directly impacting the availability of such medicines. Manufacturers are unable to meet the growing demand given the supply chain crisis. There is a shortage of drugs like amoxicillin, cephalosporins and other widely used antibiotics. The inadequate supply is causing concern among doctors and health officials. These are the drugs that medical professionals rely on for treating wide-ranging conditions from ear infections to pneumonia. The shortage of drinkable amoxicillin for children in France has got to a point where health officials are asking doctors to stop prescribing the medicine, while some experts have suggested that the drug be diluted. Belgium, Italy, Germany have also reported a short supply of amoxicillin. Data released by Brussels shows the shortage will continue at least until early 2023. The United Kingdom is also reporting a similar disruption in the supply of antibiotics, especially the ones needed to treat infections caused by the Strep bacteria. This is a bacteria that is commonly found on the skin or in the throat and can cause a variety of skin, soft tissue and respiratory tract infections. Doctors in the European Union are now preparing guidelines to recommend shorter courses of antibiotics to conserve the existing supplies. However, doctors have expressed concern about limiting the duration of the treatment, as it could mean some people may not be able to get rid of their infections. The acute shortage can be attributed to several factors, such as a surge in demand due to more illnesses with no COVID restrictions now in place. Moreover, manufacturers are facing delays in the supply of pharmaceutical ingredients due to China's COVID restrictions. Rising energy costs are also making some energy-intensive production difficult to sustain. For more on this story, we're now joined by Amish Adalia, a senior scholar and a physician from Johns Hopkins Center for Health Security and Infectious Diseases. Thank you so much for joining us here on WION. Now, we have listed in that story several factors that are causing this acute shortage of antibiotics in Europe and even in the US. But how grave is the situation according to you? Is this unprecedented in some ways? And how are governments and health authorities in these countries dealing with it?
It's not unprecedented. We've had antibiotic shortages all the time. This one is just hitting the headlines because it's happening in more than one place at the same time as a big spike in respiratory viruses. And I think it's not something I would consider grave, but I think it makes it difficult when you're trying to prescribe antibiotics if you have to take extra steps to ensure that your patient is able to get the correct antibiotic. But remember that many of these infections, many of these antibiotics are interchangeable and there are options. So this isn't something that is very dire, but it is something that is problematic and really emblematic of the way that demand forecasting is very bad when it comes to what drugs are going to be needed.
Right, you're saying, Dr. Amish Adalia, that this isn't the first time that such a shortage is being reported, but it's making headlines because it's happening in so many countries across Europe. Now, there are reports that in France, health officials are asking doctors to stop prescribing amoxicillin. Doctors in the EU are preparing guidelines recommending shorter courses of antibiotics, which may not be enough to cure people of their infections. And that sounds very grim. One wonders what the WHO, for example, would say about such medical advice which is being dispensed. When, according to you, is the situation likely to ease?
You have to remember that most antibiotic prescriptions for respiratory infections are inappropriate, that many of these are caused by viruses, and doctors may give antibiotics just in case. And we know that probably 80% of those prescriptions, for example, for amoxicillin, are probably not necessary. So I think we have to get better at antibiotic stewardship and not prescribing them for viral infections. So I think even though it might be alarming that you're hearing people say not to prescribe them, you have to recognize that many of those are inappropriate prescriptions to begin with. The same is true for length and duration. We often treat infections longer than they need to be treated, and I think we need to get better at actually optimally treating patients for whatever duration they require. this shortage is likely to continue, as you stated, into early 2023 as we move through respiratory virus season, because this is causing a spike in demand for those antibiotic prescriptions, whether they're appropriate or inappropriate. But until we get into 2023 and see these respiratory viruses, at least in the northern hemisphere, start to decrease, you'll probably see these same spot shortages in different geographic areas.
All right. It's interesting. You believe that in many cases these antibiotics are actually prescribed inappropriately, but one still does hope that the situation eases soon enough. On that note, Dr. Amish Dalia, thank you so much for speaking to WION.
Thanks for having me.